Implant dentistry, from consultation to final restoration. Implant dentistry has transformed the world of dentistry by offering patients a long-lasting alternative to losing teeth. From initial consultation through final restoration, the process of implant dentistry can transform your life. In this short video, we'll look at the different steps during the process of implant dentistry, starting with the initial consultation through to finishing the restoration. Consultation. The initial step of the process of implant dentistry involves a consultation with a specialist in dental implants. In this appointment, the dentist will evaluate the oral health of the patient and decide if they are an appropriate candidate for dental implant. It could involve taking X-rays as well as establishing a treatment plan that is based on the individual requirements. Implant placement. After the patient is considered a good implant candidate, the next stage is to place the implants. The procedure involves surgical placement of the implants in the jawbone. There it eventually will join the bone, a process known as osseointegration. This is a crucial step to the longevity of the implant because it creates a solid base for the restoration. Healing process. Once the implant is installed, it will require some time to heal before the final restoration is able to be attached. The healing process could take some time, since the implant must connect to the bone prior to it being able to support the final crown. In this period, patients may receive a temporary crown to fill in the space caused by the tooth that was lost. Final restoration. After the implant has completely repaired and bonded to the bones, the final reconstruction is able to be attached to the implant. It could involve the installation of a bridge, crown, or denture, based on the individual requirements of each patient. The final dental restoration is made to fit the individual's teeth and create a smooth and natural-looking smile. Aftercare. Once the final restoration is in place, after the final restoration has been attached, patients will have to take care of the dental implants in order for their long-term health. It could mean periodic dental cleanings and checkups and proper oral hygiene at the home. If properly cared for, dental implants will be used for a long time and offer patients an option to replace missing teeth. Conclusion. Dental implants offer patients an effective and permanent alternative to losing teeth. From initial consultations to the final dental restoration procedure, getting dental implants could transform the lives of numerous patients. When they understand the different aspects of the process of implant dentistry, patients can make educated choices about their oral health and get an attractive and healthy smile.